Welcome everyone to this month's discussion on an interesting article, Understanding Racial Disparities in the Care of Patients with Irritable Bowel Syndrome, the Need for a Unified Approach, published in the current issue of Neurogastroenterology and Motility Journal. My name is Dr. Purna Kashyap. I'm a gastroenterologist at Mayo Clinic in Rochester, Minnesota. It's my great pleasure to welcome Dr. Dipesh Vasant, who's a consultant gastroenterologist and honorary senior lecturer based at the University of Manchester in the United Kingdom. He has a specialist interest in the management of disorders of gut-brain interaction and severe gastrointestinal motility disorders. Welcome, Dr. Vasant, and thank you for joining us for this chat today.
Thank you very much for inviting me.
Before we talk about the article, I wanted to ask what got you interested in healthcare disparities research?
I think one of the main factors that interested me in this area is there has been a number of studies which have looked at the global impact of irritable bowel syndrome. And one of the most important studies was, of course, the Rome Foundation Global Prevalence Study, which has really confirmed that this is a global condition. But there are important regional differences around the world, which imply that cultural factors are very important, as well as socioeconomic factors. And also, in addition to this, mainly brought into focus during the current pandemic, there's been a lot of research on healthcare disparities and in different areas of gastroenterology. So I think this is really what stimulated my interest in this topic.
Great. Can you provide a broad overview of racial disparities in healthcare among patient groups and more importantly, what are the unique challenges for patients with disorders of gut-brain axis like irritable bowel syndrome?
Thank you. I think when we break it down, I think there are three important factors which are relevant here and interact. I think one is patient cultural factors. I think there are factors within the culture of healthcare professionals themselves, and also the institutions, the cultural factors within the healthcare institutions and within which they work. I think the unique challenges in disorders of gut-brain axis are that there are no positive investigations which confirm the diagnosis. And I therefore think communication is very important in terms of outcomes and in terms of acceptance of the diagnosis. So I think it's very important, and in an ideal world, it's important to say that all of us would aspire to providing equal healthcare opportunities and treat patients the same way, regardless of what their cultural background is or ethnicity. And I think that's the unique situation in this context.
Great. It's interesting you mentioned cultural factors, and you know, recently had a discussion about the role of stigma in terms of healthcare delivery, and especially in this specific patient group. So could that be one of the factors which drives these healthcare disparities?
Absolutely. And one of the interesting factors from the Rome Foundation study that there was a difference in the prevalence of IBS depending on whether it was a face-to-face interview or whether it was an online entry in their response to the survey. And this implies really that there may be a taboo factor of bowel symptoms for some cultural groups related to their ethnicity or healthcare beliefs. And some people may not be so forthcoming with these types of symptoms, or the way in which they present to a healthcare provider may be different. And I think raising awareness of these issues and being aware of stigma, as bowel symptoms are quite embarrassing for patients, some groups of patients. And so I think this is something that we need to be sensitive to in this field as healthcare providers.
Great. And any other factors that you think are responsible for racial disparities in these group of patients that you haven't mentioned?
Yes, I think one of the interesting factors is that a lot of the research has been done in privatized medical settings, and therefore it's unclear as to whether socioeconomic economic factors play a role here in sort of access to healthcare in different racial groups. And therefore, it would be very interesting if similar studies were replicated in government-funded healthcare systems and in other countries to see if socioeconomic factors are playing a big role.
Great. So what is the objective evidence in terms of impact on outcomes as a result of these disparities? And is it different in different places? How does this vary across the geography?
So I think a lot of the evidence for good management of disorders of gut-brain interaction, and a lot of the current guidelines are focused on making a very positive diagnosis as opposed to a negative diagnosis. And so there are risks, whilst there isn't any direct data on this in healthcare disparities, the data that is emerging suggests that patients from ethnic minority groups may be more likely to have an invasive procedure. And as we know, there are small but significant risks associated with complications with unnecessary procedures. And so ultimately, the acceptance of the diagnosis in patients who are repeatedly over-investigated, maybe we could speculate that that could lead to poorer outcomes, and also implies that the doctor-patient interaction, which is very key in predicting a positive outcome, there may well be a communication deficit or barrier there. And so this is an area that I think does need further research to look at differences in outcomes, but we are now sort of seeing that awareness that there is some evidence of disparity, and that is a very positive thing to try and sort of minimize and eradicate disparities in our approach to patients, regardless of their ethnic background or racial background.
In that regard, I'm sure you're aware, in the same issue of Neurogastroenterology and Motility, there's a paper from Casey Silvernale, Braden Kuo, and Kyle Stoller from Mass General Hospital in Boston, who described the results on racial disparity in healthcare utilization among patients with irritable bowel syndrome in a multicenter cohort. I was wondering if you can elaborate on those findings and how they fit what you've been talking about.
This was a very interesting study, and thank you for the question. I think one of the key findings is that people from ethnic minority groups were less likely to be seen by a specialist and referred for an opinion, and so that's something of concern. And I think it's unclear of the reasons for that, and that might merit future research, but it is important for primary care providers to be made aware of this problem. I think also there is some evidence from these studies that the demographic of the clinicians, the diversity may be an important factor moving forwards. And I think there might need to be a positive shift towards increased cultural awareness amongst clinicians. As I said previously, I think it may well be that further research is needed in this area. For example, it was unclear whether those from ethnic minority groups were satisfied with their care in primary care, or whether their IBS was less severe such that they didn't need to be managed in specialist services and settings, and or whether they were reassured because a larger proportion of people from ethnic groups had investigations compared to their white counterparts in the study. So it's unclear as to whether that led to better satisfaction or worse from the design of that study. But I think, in summary, that study has really raised awareness that there is some evidence of disparity. And I think further studies may tease out the reasons for that and how we can best, improve outcomes and improve these factors.
So what do you think, it's always the million-dollar question in terms of what are the potential solutions? So I think we all realize this is a problem, but what can we do now in the short term, and what would we need to be put into motion now so that in the long run, we see much more healthcare equality?
I mean, we're currently in IBS Awareness Month, and as yesterday was IBS Awareness Day, and I think improving awareness amongst healthcare professionals is a positive step. I think also communicating in patients in a very sensitive way from different backgrounds and is very important in sort of gaining their trust and improving patient outcomes. And that's been shown in other IBS research. And I think also there might need to be a positive shift in actively recruiting gastroenterologists and healthcare professionals from a wider, diverse group, so that there's increased understanding and this may also reflect the population with which we're treating. So I think there are a few positive things, and it is quite good to be aware of these factors so that these changes, and we're seeing that in other areas of gastroenterology as well, that we're becoming increasingly aware of disparities in colorectal screening, for example, and other conditions.
Great, and that's sort of what my list of questions was. I was wondering, is there anything else you wanted to mention which I might have missed out, or something you wanted to let us know?
No, I think that's covered everything. Thank you very much.
With that, I would like to thank you, Dr. Vasant, for this excellent review and assisting us with the podcast this month. I would also like to thank our listeners for tuning in, and look forward to welcoming you again next month with another exciting article.